Osteoarthritis, OA, is a condition faced by many adults, commonly seen in the hip and knee. Osteoarthritis occurs when the cartilage that cushions the ends of the bones in your joints gradually thins, with new bone growth occurring to stabilize the joint. When making a diagnosis, doctors look for certain signs and symptoms which can include joint pain following activity which gets better with rest, short-lived stiffness in the morning or after rest, reduced range of movement of the joint, identified bony swelling. A diagnosis of OA does not necessarily mean a continued deterioration in the joint. Indeed, a joint in the body can repair itself. Wear and repair is a more apt phrase than wear and tear. Exercising a joint helps to strengthen the muscles around the joint and increase its range of movement. So exercise helps to ease a joint problem, not make it worse. Build up slowly and take rests when needed, but try to be physically active every day. There's a great deal of evidence that being overweight increases the strain on your joints, especially your knees. Research shows that being overweight or obese not only increases your risk of developing osteoarthritis, but also makes it more likely that your arthritis will get worse over time. Apart from keeping an eye on your weight, there are a number of other ways you can reduce the strain on your joints. Pace your activities throughout the day. Don't tackle all the physical jobs at once. Break the harder jobs up into chunks and do something gentler in between. Feeling down and frustrated is a natural and understandable reaction. If pain and stiffness make it hard to get out and about, socialize and do usual things. Continuing to join in social activities and do valued pastimes is important for giving structure and purpose to daily life. Ice and heat are safe, effective and cheap ways to relieve pain or swollen joints. Packs like wheat gel pads can be made warm or cold. Cold can relieve swelling and thus help ease pain. An ice pack or bag of frozen vegetables can be applied over the joint for up to 20 minutes every couple of hours. Do not apply ice directly to the skin as it can cause an ice burn. Wrap the pack in a tea towel. Some people use heat and cold alternately. By a process of trial and error, you can find out what works best for you. For most people who have OA, their joint problem will not get worse. The most important thing that they can do is to continue to be socially and physically active, which is vital for both a sense of well-being and physical health. Should symptoms worsen or not improve, your primary care clinician will refer you to a specialist for further assessment. X-rays may be arranged at this point to see how much the joint is affected. Usually, joint replacement surgery is only considered when symptoms are having a substantial effect on an individual's ability to do everyday activities, and after a patient has tried at least the basic forms of treatments previously described. All decision-making around your treatment options will be made with you at all times, and you will have the opportunity to ask any questions relating to your care throughout. If you would like more information on knee or hip OA, you can get free advice and support from www.versusarthritis.org. You can also contact them free on 0800 520 0520 between 9 a.m. and 6 p.m. Monday to Friday.